Welcome to the Fear and Greed Daily Interview. I'm Sean Aylmer. Some of my favourite interviews on this podcast are the ones where I know very little about the subject matter because I'm guaranteed to learn something. I think today's interview fits into that category. Microba is an Australian biotech company using microbiome science to improve human health. That is, understanding the links between gut microorganisms and health. And the company has some real heavy hitters behind it, including Professor Ian Frazer AC, known internationally as the inventor of the Gardasil vaccine. Professor Frazer is the chair of the Medical Advisory Board of Microba. Now, aside from medical innovation, the other thing that stands out with Microba is that it's part of the booming medical technology scene in Brisbane. Microba has benefited from the medtech accelerator program and initiative of the Brisbane Economic Development Agency, which is a supporter of this podcast. Dr. Reid is the CEO of Microba. Luke, welcome to Fear and Greed.
Thank you, Sean. I appreciate your time.
Righto. First up, let's start at the beginning. I said microbiome science, and I was hoping that I had pronounced that correctly. If I'm not sure how to pronounce it, I certainly don't quite understand what it is. Please explain.
I think you did a great job pronouncing that.
Thank you.
And you were right in your description. We're all about the trillions of organisms that live in your gut, known as your gut microbiome. And we believe that they represent one of the biggest untapped opportunities to improve human health. And because of that, we will see microbiome testing and therapeutics become a routine part of healthcare. And we believe at Microba that we have the best technology in the world to unlock that opportunity. So what we've been doing here at Microba, based on that world-leading technology for measuring the microbiome, is delivering microbiome testing services now globally. We ultimately believe that testing those organisms that live in your gut will become as routine as a blood test. And we discover and develop novel therapies from the gut microbiome. And we have our first drug candidate about to enter a phase 1 clinical trial.
Okay, we'll get to that in a moment. But what are the chronic diseases that you're talking about? What are these gut diseases?
So chronic diseases are the leading cause of death and disability worldwide. They now affect 6 in 10 people. I think we all know a loved one that has been impacted by either cancer, depression, diabetes, inflammatory bowel disease, heart, or another chronic disease. So we're not just talking about diseases that center around the gastrointestinal tract. We're actually talking about diseases that impact the whole body. But what a lot of people don't appreciate is that gut health, and more specifically, those trillions of organisms that live in your gut called your gut microbiome, are actually a key missing piece in resolving many of those chronic diseases. And there's now more than 100 clinical studies demonstrating that if we make changes to that community of organisms in your gut, that we can actually change the course of chronic disease outcomes.
Wow. That's pretty amazing. So you said you had something in just explain what you have in testing. Did you say what phase testing?
So we have been building now for around 5 years, a global data bank of information around people's gut microbiome and their state of health or disease. And what we've been doing is mining that data to understand at an entirely new level the differences in those trillions of organisms in your gut between those healthy individuals and the diseased individuals. That's enabled us to discover therapeutic leads for multiple chronic diseases. And we've now got a lead drug candidate for ulcerative colitis, a particular form of inflammatory bowel disease that we're just preparing to move into a phase 1 first-in-human clinical trial. So it's really exciting because these novel therapies represent natural biology that we're tapping into, which is representative of what a healthy gut microbiome looks like, and could represent very safe and novel, effective therapies for these debilitating chronic conditions.
Look, pardon my ignorance here. So an unhealthy gut microbiome is very possibly an indicator of, well, potentially you can get quite specific about what that actually indicates in terms of ailments in other parts of the body.
That's correct. So we have now seen clear signals in our data bank that show a really striking association between the microbiome and 18 different forms of chronic disease. And we've seen firsthand through the delivery of microbiome testing services now globally, together with a range of medical diagnostic leaders, that we can measure the microbiome with respect to healthy reference ranges. Now we can start to implement diet, lifestyle, and supplemental change to be able to move that community of organisms to a better state of health. And ultimately, we will get sharper and sharper about how that can be deployed in the management and treatment in a range of chronic disease settings.
Stay with me, Luke. We'll be back in a minute. My guest this morning is Dr. Luke Reid, CEO of Microba. The area that you're working in is incredibly exciting and vast. How important is it to have someone like Ian Frazer, Professor Ian Frazer, involved with a company on two fronts? Obviously, he's brilliant, but also his name must help open doors.
Absolutely. Ian, firstly, is such a kind and generous human being. He really is, and he continues to be an absolute bedrock of the Brisbane and Queensland medtech and biotech community. He's one of Australia's most distinguished clinical scientists, and as many will know, he's the inventor of Gardasil, the cervical cancer vaccine, which is now a substantial drug for Merck, which did around $7 billion in sales last year. So Ian had a relationship with our two professor co-founders, Professor Phil Hugenholtz and Professor Jean Tyson. And with his immunology background, he could see the very clear vision and opportunity that our two co-founders saw, that the human gut microbiome is one of the most important and untapped opportunities to start to advance and make further progress in the treatment and management of chronic diseases. And a lot of that centers around the interaction between those organisms in your gut and how they train and modulate your immune system. So that was really the connection for Ian and where his background comes in. But he was a supporter from day one. He was an early shareholder. He today is our deputy chairman, and he also chairs our medical advisory board. He's been a fantastic mentor to myself and other people in the team. And he's been a really important pool of experience as we've executed on this global opportunity in front of us to create a world where human health is transformed by microbiome science.
Okay, now another organisation which is very keen on Microba is Sonic Healthcare, because they took a 20% stake in the company last year. Once again, I mean, Sonic's one of the largest diagnostic companies in the world. Presumably that helps as well, not just as a shareholder, everyone likes shareholders, but also access to new markets and also the concept of commercialising what you're doing.
Absolutely. That partnership with Sonic was really transformational for the company. It builds on a bench of medical diagnostic leaders that we've been assembling to take our testing technology into market globally, into the hands of clinicians and patients to support disease management. So Sonic took a strategic shareholding position, which was substantial, and that really strategically aligns the interests of both companies as we look to drive microbiome testing into that future where it is as routine as a blood test.
I mean, that needs commercialization. Is that to get to that point is often difficult. Is this where the medtech accelerator comes in, basically to help speed up that path to commercialization?
That's exactly what Beta have set up through the medtech accelerator. They've put together a program and brought around that program, expertise, training, access to global networks to be able to accelerate commercialization of Brisbane medtech technologies. So it's a really fantastic initiative. It's one that we have put strong support behind. We've been directly, mentoring and working with a range of those companies that have gone into the accelerator. And for Microba, we actually already work with some of those companies. So there's a fantastic ecosystem that's been built here in Brisbane with support of Beta, where we are now really getting some groundswell to be able to take these technologies onto the global stage. An example of that is our partnership with Midnight Health. They're a fast growth consumer health company providing online healthcare solutions to Australians and on a strong growth trajectory. They recently received investment from major health insurer NIB, providing them with access to NIB's 1.4 million members. And so the partnership we've brought together, and Midnight Health are a part of the Beta Accelerator, is delivering a world-first subscription-based service branded as Vitality. And what Vitality does is provide a personalised gut health supplement based on an individual's gut microbiome test result powered by Microba's testing technology. So for me, that shows how this collaborative environment has evolved within the Brisbane medtech community and how we start to create synergies that can create new opportunities to take to market.
What is it about Brizzy? Why suddenly, sort of becoming a hub for medical technology?
Brisbane is really unique, Sean. We've got access to major hospital networks, world-class research facilities, advanced manufacturing capabilities now, and importantly, top-tier university talent. And I think it's nice that of the outstanding affordability and lifestyle that Brisbane affords continues to draw in that talent to Brisbane both nationally and internationally. And as a result, it's not a surprise to me that Brisbane is now Australia's fastest growing capital city and Australia's fastest growing population.
And it's got some pretty good universities as well.
It does. And it has the tailwinds of the Olympics coming up as well, which is leading to new infrastructure and a whole range of investments being made. So there's a lot happening and a lot going for Brisbane.
Okay, so what next for Microba? Obviously, these phase 1 trials are very exciting.
Absolutely. We are continuing to execute on the growth of our testing services. So we'll start there by saying, through our leading bench of healthcare partners, now adding in Sonic, but we also have SynLab, which is Europe's largest pathology company. As a partner, we have the leading gastrointestinal pathology company in North America called Genova Diagnostics, and we have a really aggressive healthcare leader in the Middle East called G42 Healthcare. And through that leading bench of partners, we now have access into 35 countries, and we've operationalized 7 of those today. So we've got significant growth ahead as we continue to operationalize those partners to get Microba's testing technology into the hands of clinicians and patients across the globe. And then on the other side, as you mentioned, we're going to rapidly progress our novel therapeutics into clinical development and through to key value inflection points. And ultimately, we plan to partner with Big Pharma at the right time to take those assets through late-stage development and onto market.
Luke, good luck and thank you for talking to Fear and Greed.
Thank you so much, Sean.
That was Dr. Luke Reid, CEO of Microba, which is based in Brisbane. The Brisbane Economic Development Agency is a supporter of this podcast. This is the Fear and Greed Daily Interview. Join us every morning for the full episode of Fear and Greed, Australia's most popular business podcast. I'm Sean Aylmer. Enjoy your day.